This is the Second Chance at Health podcast. I'm your host, Dr. Brad Hassig. Come join me as we remove confusion from the hottest health topics by discussing the latest research, along with what we've seen with thousands of our patients and amongst our community, family, friends, and people all over the nation and world. Let's dig in. Hey, this is Dr. Brad Hassig with the Second Chance at Health podcast, coming today with episode number 17, The Sick Truth About Healthcare. This is a great, I recently read this interview with Tucker Carlson with Casey and Callie Means, and as brother and sister talking about a lot of things in functional medicine that I've spoken about. And I just thought I'm just going to kind of give some highlights of this interview. It's over 2 hours. I've listened to it twice already. It's absolutely fabulous. So I highly encourage people. I know a lot of people aren't going to take the time to go through and read that or listen to that entire interview, but I really think it's something that is important. So I'm just going to kind of hit some of the highlights, the things that really stuck out to me, things that kind of impressions that it left me with. Please feel free to listen to the whole thing. You can go to any Apple. It's on YouTube. It's wherever you're at. Look at the transcripts. You can go through and look at some of the chapter highlights, things like that. If there's particular health topics that are of interest to you, but it's about the time I listen to it working out, cutting the grass, different times, doing things, sitting outside, driving in the car, going to pick up kids, whatever, kind of fit it in, different chunks of time that I listen to it. I didn't sit down and listen to it straight. Nobody has that kind of time to do that, but it's absolutely worth it. So I'm just going to hit a few of the highlights, things I found most interesting. I do want to go over a Bible verse that I thought that kind of ties into some of this, and it's the prayer of Jabez. You'll find it in 1 Chronicles 4:10. Jabez cried out to the God of Israel, "Oh, that you would bless me and enlarge my territory. Let your hand be with me and keep me from harm, so that I will be free from pain." And God granted his request. That sometimes, I'm trying to kind of find things that tie in. I always want to faith is so important to me. Faith is intertwined with all of this. I want to have faith and healthcare, knowledge, tips to kind of give you. And those two are just absolutely interwoven. So that one to me really, really resonated with this particular topic. Like I said, this interview is available wherever you want to find it. So please go and look at that. So just if you need to look it up, Tucker Carlson interview with Casey and Callie Means. One of the first things that I thought was interesting, they give the background, talk about the brother and sister. So the sister, they're both incredibly intelligent and well-spoken. The sister, they both went to Stanford for undergrad. The sister then went to Stanford Medical School. I believe she was top of her class. She was in surgery, was going through, I think, 9 years into post-grad, not just neck surgery. It was a specialty within that. I think she was getting into whether it was in the ear, kind of ENT area, but it was a hyper-specialized type of surgery that she was doing. So very intelligent. And I believe it was a surgery. It was a patient that had been in for the third time for sinus surgery. And she was like, what are we doing? What am I doing here? This patient keeps coming back for the same thing, and they're going to be back again. We're not getting to the root cause of what the problem is. And so really kind of started asking a lot of questions. And you see that with both of them, the brother and the sister, that they're constantly, just asking questions, wondering what's going on, problem solving. And so she turned her scalpel in. She literally went to the head of the department, walked in, set her scalpel down and said, I'm done, and didn't have a plan. Huge student debt. Loans, I can attest to that. Between myself and my wife, it's very, very nice houses you would have for the student debt loan when you start combining some of that. And so, it's it's hard to believe. I'm proud of her. I don't know her, but I'm proud that she did that. Brother, once again, very intelligent, very, very well-spoken, Stanford undergrad, Harvard MBA, I believe Harvard Business School, and had worked with big pharma, wanted to do stuff in politics. They're both from Washington, D.C., and I believe from the same area, close to where Tucker Carlson was from. Very accomplished. Same thing, had a lot of insight from working in that industry in Washington, D.C., big pharma, big food, seeing the stuff that was going on. Same thing, had questions, what's going on, with this doesn't seem right. So one of the first stats that I loved that they threw out was talking about how 90% of med schools don't even require one nutrition class, which just absolutely blows my mind. That's hard to believe. That was, we had a fair amount of nutrition in chiropractic school and college, obviously a degree in biology in undergrad, Indiana University and so it's hard for me to believe that medical schools don't do that, but it's, 80% of the course loads are in pharmacology in the medical school. So it's sick care. It is not healthcare. It's sick care. That's hence the name of the title that I had with this. So, pardon if I'm a little passionate. Generally, I try and be pretty optimistic and uplifting. This one kind of had me fired up. So, a couple of the other things that are neat. We're going to try and keep this one on short and to the point. I want people to go and listen to this. It's absolutely worth it. Hopefully, if I just hit you with a few things, it'll entice you to go and listen to this whole interview. It was talking about the food pyramids and this stat, R.J. Reynolds and Philip Morris, they were the cigarette companies. And in the 90s, the two largest food companies in the world were purchased by R.J. Reynolds and Philip Morris. So the cigarette companies, after they had all the Surgeon General stuff and antitrust and the laws were coming out, they were flush with cash, but they needed to shift gears in terms of what they were doing. So they go into the food industry, and they took their scientists and charged them. First of all, they had been incredibly good at getting people, and especially kids, addicted to cigarettes. They did it through, obviously nicotine, different chemicals that they were putting in, advertising, trying to make it, you think of a Camel, you think of the cool Marlboro guy, you think the slick marketing, but it's also the addictive properties, of the actual chemicals that are in there. So they purchased these foods and they charged their scientists with trying to make food as addictive as possible. And so that's when you're starting to see a lot of this processed food. You're starting to see some of the highly, highly processed foods. You're going to see high fructose corn syrup. You're going to see things like seed oils. Seed oils were incredibly cheap. Seed oils, it's funny, they were looking at things that seed oils were originally, oil lubricants. They were byproducts of oil, the oil industry. This stuff is just, it's so insidious. It's got me so fired up. And then you look at through the food companies, they're buying and paying off the FDA. You think back to school, the food pyramid and how many cereals, the grains, get as many grains as you can. And truth be told, the grains, I tell my kids this all the time, the grains that they're getting nowadays are not what we had. And it most definitely isn't what our parents and grandparents had. You look at companies like Monsanto and, Roundup, and then you look at some of the different pesticides and herbicides, genetically modifying things. Our bodies can't recognize this stuff. So this is all inflammatory. So that was one thing, it's you look at our kids' diet today, they said up to 70% is ultra processed food. This food was literally invented by the cigarette industry to get kids addicted. Now, the name of the game with all this is, and I've talked about metabolic disease, type 2 diabetes, even type 3, where you're getting into some of it pre-diabetes. Type 3 is even getting into the cognitive decline. The goal of these companies, and it's the drug companies, the food companies, is, FDA, all of this is tied in together nowadays, is to get kids addicted, is to get kids sick. The goal is to make as many kids as possible type 2 diabetic. And you're better off to hit the kids because that's a longer lifetime that they're going to be patients. And so if they can get them sick, then this starts to tie into, and this one's driven me nuts for a long time, when you're getting into things like Ozempic. And this is, I love, they said on the thing, Tucker Carlson was saying, this one will not be monetized by YouTube. I might get in trouble for this. I don't care. Just for saying some of these words. But, Ozempic is that's one of the things that is used for diabetics, incredibly expensive. And they want to get it to where it's approved for kids down to 6 years old. So if they can get people sick because of food, they're trying to make, with blood sugar issues, metabolic issues, trying to make as many people, 50% of kids are overweight now in the United States. They had a study and they showed, and they were talking about, in Japan it was 5%. United States, it's obesity rate. This is just absolutely crazy. It's insane. And they've made the villain fats for years and years. Couldn't be further from the truth. And once again, my feelings on the different types of diets. Not saying everybody has to be keto, carnivore, whatever. If somebody's saying, hey, I'm going to be vegan and get all organic, grow your own, where you can control whatever it is, go for it. Find something you're going to stick to, but as long as it's not ultra processed, refined foods. You think of even, I saw a thing where I hesitate to even say the name, but a certain celebrity political figure, she has a ownership in a juice company, and talking about juice is highly refined, and it's better than soda, slightly. It's still incredibly high in processed sugar. So this interview, go back, listen to it. This ties in with what we've been talking about. That's the whole purpose of this. I want this to be enough. I want to keep this short. We're at 12 some minutes. I'm going to stop this, now, just because take the time and go search this Casey and Callie Means interview with Tucker Carlson. Listen to it. It's a lot of their background in the beginning, which is interesting, very interesting, gives the background of the business and the science behind what's going on. Just an incredible tandem of people to go over this. Listen to it. Let me know what you think. And let's get after this. This has got me fired up. It's once whoever they is, these groups are trying to make our kids sick, kids, grandkids. Their goal is to make us sick and get us on to as many drugs and medications as possible. Their goal is to create lifetime patients. It's our kids' future, our grandkids' future. Let's get after this. Let's fight this with everything we have. Listen to this, leave some comments, and let me know what you think. Take care and stay healthy.